access to mental health support for kids has never been better. And that is something worth celebrating. There have been expanded services for kids to receive the help they need when it comes to their mental health. There are school-based mental health clinics now where schools have hired mental health clinicians, or there are partnerships with organizations in the community who actually go into schools and make sure that if a child has any reason that they wouldn't be able to attend a session in an office, if their family doesn't have transportation, or if it's just in any way a barrier, we can meet them where they are. We've also increased telehealth options. That was a thing that came about during the pandemic as a widespread option for people to receive mental health services, and we've held on to that for those kids who it's appropriate for, which has increased even more accessibility. And it allows more kids to receive therapy and counseling without having to wait months and months to just see someone, or wait forever in a lobby, or the need for travel for those families who that is a barrier for. There have been federal and state investments. There are programs like the Children's Mental Health Initiative, which is a national program, and then state-led efforts in the state of Kentucky. I am proud to say that there are millions of dollars that have been poured into making sure that kids have access to the programs they need for their mental health. Isn't that just amazing? It's so cool to know that if a child needs help, they can get that help now. And then there's early intervention programs, which are services that can help identify issues earlier. It's these pre-K programs, these child development center programs. There's Head Start that makes sure that if a child is young and we can see some signs that they're going to need some care, we get them in right now, which is reducing the need for intensive long-term care later. It lets them just deal with it when it's a small issue without it blowing up into something that is beyond control. And we've focused on the impact on families, and we've found that when children receive this appropriate support, it improves the overall emotional health and functioning of the entire family. It's not just about the one kid. Yes, it is great when one kid receives the help that they need, but that help causes a ripple effect. And so when we can get in and get to things when they are much more manageable, and I don't ever believe that there's a problem or a difficulty that means that someone should lose hope or that they are too far gone, but I can tell you that the earlier we can get in and the earlier we can deal with these things, the better we're able to offer consistent support. And then over time, this child might not even need professional care, and that causes a ripple effect that spreads throughout their entire family, and that spreads through their entire community and beyond. And we've reduced disparities. We've made sure that underserved and rural communities, or populations who have previously not had access to mental health treatment, now have access to mental health treatment. We've made sure that we're making strides everywhere, and we're helping all kids benefit. That is something to celebrate. You can hear it in my voice. You can see it on my face. This is a beautiful thing for our kids. And if this progress gives you hope, like it gives me hope, hit like and share it with a friend who might need this encouragement. And subscribe to stay updated on even more topics like this. The topics you won't see everywhere else, but the ones that will hopefully bring a smile to your face or a happy tear to your eye.